Well, good evening, ladies and gentlemen. Welcome again to 103 FM's Men's Healthcare Power. I'm your host, Dennis Webster. If you're a regular listener to this show, welcome back. If you're tuning in for the first time, I hope you find the hour to be informative and enjoyable. I would like to start off by reminding you that you should always seek the advice of a physician or other qualified healthcare provider if you have questions regarding a medical condition, and that you never disregard professional medical advice or delay in seeking it because of something you've heard on this radio program. Now, tonight's Men's Healthcare Power is brought to you in part by Val Park Chinese Restaurant. Now, if you're not familiar with me and what I do, I am a registered nurse by profession, trained in oncology, and I write a regular column every Monday in the Trinidad Express with a focus on men's health. If you read my column yesterday, it basically addressed, the care surrounding our Prime Minister, Dr. Rowley. And again, I would like to thank Dr. Rowley for stepping up to the plate and sharing, his basically, personal information with us and encouraging men, to go out and get checked. As you know, in his case, there was an abnormal PSA level, meaning that when he went and took his blood test, the result came back high. And I think in situations like that, it's very important that we reassure men quickly that a high result doesn't necessarily mean prostate cancer is present. I think, when you go to have your PSA testing, you're going to get tested to see if you have a problem with prostate cancer. So I think it's very important that, if your result comes back high, that your healthcare, provider, basically reassures you that the high level, it's not necessarily related to prostate cancer, and it could be other causes that they will investigate before, coming to that sort of conclusion. Non-cancerous enlargement of the prostate, as I mentioned before, affects more than a third of all men by age 50. So if you're getting into your 60s or 70s, for sure, you can expect that your prostate is going to be growing a bit. Some men will have no symptoms, but the majority of men will have some sort of symptoms related to an enlarged prostate, one being an elevated PSA level. Another thing that men experience also, and that could cause your PSA level to be elevated, is something called prostatitis. Now, prostatitis is infection or inflammation of the prostate. Now, although you can have bacterial infection of the prostatitis, the majority of prostatitis cases of unknown etiology, meaning that they don't know actually what causes it, but they know that it, in a lot of cases, is a response to antibiotics. So if you're a man out there and you're dealing with a lot of prostatitis, because it can be acute and it can be chronic, meaning if it's chronic, it has, there are periods where it'll act up and then settle and then it'll act up again. So if you're being treated for prostatitis especially, you should know that, after treatment, it can take sometimes 6 months or so for your PSA level to return to your normal range. So there are lots of reasons why the PSA could be elevated, not necessarily prostate cancer. So I think it's important that we reassure men that, that can happen. I want to share with you this evening a recent report that came out. Actually, it was accepted, I believe, in June of this year, 2016, and it was done by local practitioners here in Trinidad and Tobago. It's actually really great information, and I would like to thank all the individuals who were involved in actually putting this information together and publishing it. Now, if you want to be part of the show, I'd like to take a minute and remind you that there are 3 ways you can be part of the show. You can give us a call at 628-4103. You also have the option of logging online at 103fm.net, or simply send us a text message, if you like, to 4103, and with your questions or concerns, anything you'd like to share with us, feel free to contact us. Now, there was a report that I said just came out in 2016 June by local physicians here, one local physician and some researchers. It's actually been published in the Advances in Urology publication, and if you would like a copy of it, you can send me an email. My email address is gprl3012@gmail.com. Now, you can send me a blank email to that address, and in the subject column, if you put report, I have a system set up that will send you automatically a copy of that report. But I found the information, very interesting, and it also brings up a few questions that I have with regard to, our healthcare system and actually trying to make it, the best it can be. In order to do that, we have to be able to have policies and procedures in place that ensure that, that we are able to receive, high quality care. Now, this report came out, as I said, in 2016, and it was done out of the urology department of the San Fernando General Hospital. Some of the people quoted in this publication are Ian Hussain, Rajendra Sukraj, Dr. Lester Gertz, who is a very, very popular local urologist, Natasha Rambaran, and Satyendra Prasad. So what they did was they collected, there were probably around 617 biopsies that were done at that hospital over a 2-year period. So this is going from 2012 to 2014. So what they decided to do is basically look at those biopsies and see how many, people of, Afro-Caribbean, Afro-Trinidadians and Indo-Trinidadians, what the population's been affected by prostate cancer, what the numbers are. And some of the figures are, pretty astounding. One thing I would like to point out is there were basically 617 biopsies done, but for some reason they were only able to get to find 546 of those reports. So there are actually 71 reports missing that they weren't able to find. And the first question that comes to mind to me is, where are these biopsy reports? Is someone out there looking for them? Do the people who actually underwent the prostate biopsy, are they aware that these reports are missing? Because no one wants to go and have a prostate biopsy, far less have a report, that's supposed to be given to them, go missing. So my first question is who's responsible and who's following up on, these missing reports? There are 71 of them. So there are 71 of people out there who possibly, when I did nursing, we had basically a thumb of rule that stated if it wasn't written, it wasn't done. So how do we know for sure, number one, that these 71 people actually received a report on their diagnosis to begin with, and where have these reports gone? So, that in itself is a pretty scary thing. Who's accountable? Now, what they found was there was a significant number of men in the Afro-Trinidadian population who actually had what we call intermediate to advanced, prostate cancer. And what was alarming to me is the level of PSA levels that they were finding. Like a lot of these men had PSA levels equal to or greater than 100. Now, how does a man, get a PSA level up to 100 before someone finding out? And why are men not going to, to get their blood tested? Like, for the men that I've seen, I know there are a lot of men who actually don't even understand PSA, what PSA is, what the normal level's supposed to be, what it's supposed to be looking for. A lot of people go and have blood work, and they don't have the blood results reviewed with them. So I think, it'd be interesting to do a survey, to basically find out, people's understanding of PSA, what elevated PSA levels mean, and basically, what prostate cancer is and what it's all about. Because I can't see someone intentionally waiting till their PSA level is 100, to go for testing. What do you think about that, Greg?
Well, we shouldn't wait till it gets to that point.
Like, how does it get to 100 though? If the accepted normal range is supposed to be 0 to 4, which we know there's no normal level today, like, how does it get to 100 before we find?
Well, I think it has to do with, men on the whole, at least East Indian men, as we were discussing off the air earlier on. Mm-hmm. They just tend to, they are a little bit. There was some mention
that East Indian men don't like to talk about their medical. Now, I don't know, much of the culture to make and I don't like to make general statements like that. But I've been on other shows where men have been actively, calling in, wanting to get information. We've done 11 shows now, and we basically had more women calling in for information than men. So, what's going on? Like,
man, you need to call us and express your concerns. Yeah. If you're having issues, you want to get some advice.
Like everybody good or what's going on? Like,
I think it's really, Dennis, they have the issues. They know they have the issues, but they just keep it up, bottled up, keep it inside.
Which is it's a pretty sad thing.
Yeah.
Like a gentleman called me today. He said he has a friend in his 70s who he believes, is having agonizing pain, from prostate cancer, but wouldn't leave the house. And he's not knowing, what to do. I told him he should contact a doctor. I also gave him actually a contact number for Vita's House. I don't know. Are you familiar with Vita's House?
No, I'm not.
Okay, Vita's House actually is a non-profit organization and I think the core of what they do is they help people maximize their quality of life, especially in life-threatening situations.
Right.
So, they provide an amazing service to people, and people in situations like this gentleman is in, I think they, should contact, places like Vita's House to get some sort of direction as to, how to care for these people and how to get them out to ask for help.
Yeah, well, in general, men should actually take be a little more conscious to their health and to issues that we face.
Right.
Because there are a lot of issues that we face as men, or even as young boys growing up.
Right.
That we need to pay close attention to.
So there's a mental change that needs to happen, with regard to how we approach that. Another thing I was going to say was this thing about the digital rectal examination. Now, I have my own personal opinion on that one. I believe that our job as healthcare providers is to provide people with as much current and accurate information with regard to risks and benefits of having a procedure.
Yeah.
I don't think it's our job to basically go and try and sell people on the idea of having a procedure.
Let them make that decision.
Let them make the decision, yeah. Because like we mentioned on the last show, there are two types of pain. There's physical pain and psychological pain. And some men really experience psychological pain when it comes to the thought of having a digital rectal examination. And I think that needs to be acknowledged. And I think they have that right.
Yeah.
So I think our job as healthcare providers is to find other ways of getting this important information without forcing men to go through having a digital rectal examination.
Well, I think it really boils down to how doctors in particular, or how, they deal with men on the whole in general.
Right.
Because, we already in our own zone, in our own shell, but when we go to a doctor and he, prescribes something for us, then some men may just run out of the office and be like, well, I'm not going to do it again. I'm not going to see any doctors again. And they just, they need some treatment.
Right.
They have some tests to run and they just wouldn't do it.
And a lot of men too, that I've spoken to have had bad experiences doing this, digital rectal examination. I think, some men, doctors have to be, we have to be conscious, healthcare providers have to be conscious about how we're approaching men. Are we getting them, are we making them more relaxed? How are we going to get this whole thing to be more appealing, right? Are we helping them with breathing?
Yeah.
Are they using enough, lubrication, to do these tests? So there are a lot of different, things other than a fear of losing some sort of machismo that's related, I think, with digital rectal examination. So I don't think it's a fair statement to say that men don't want to have it because it's a macho thing. Anyway, it's time now for us to take a break. You're listening to 103 FM's Men's Healthcare Power. I'm your host, Dennis Webster. We're going to take a break. Don't turn that dial. We'll be right back. Good evening, ladies and gentlemen. Welcome back to the 103 FM's Men's Healthcare Power. We're basically talking a bit tonight about this prostate cancer thing that keeps kind of showing its ugly head. A recent study that was done in 2016, so I guess about 2 months ago, it was accepted and for publication. You can now get that report by sending me a blank email with the subject report in the subject column, and you'll get your report showing you the figures. Now, like I say, there are 71 cases that should have diagnoses that are missing, so somebody needs to go and look for them.
But who is responsible for that?
Well, I wish I knew, right? I would think, as a doctor taking the samples, right? You'll want to know what the report is on the samples that you're taking, right?
It's not one; it's like
71, right? That's a significant number. So where are they going, right?
Somebody has to answer.
Somebody has to answer for that, and this is the whole part of putting high quality systems in place. It's accountability. We need to have some accountability.
Because we already have men being very private and very shy, so to speak, on their health and their issues.
Right.
And then for 71,
But do you think those 71 wanted to go for a biopsy?
exactly.
I mean, there are other things they could be doing, right? Pitching marbles, playing cricket, whatever, right? So they took the time to go and get the biopsy. A lot of them had 12 samples taken, I'm sure. Right? And no report. So what was it all about? I mean, these are serious issues, and we need to address these issues. Like, somebody has to be accountable. And
it also goes to show, Dennis, I mean, in the health sector, again, we're getting a lot of, back and forth, a lot of, sometimes when you go to, like the hospitals and stuff, you hear people say, well, we're there for 12 hours, a day, 2 days, no beds, no this, no that. This is clear negligence as well.
But how does that happen in this day and time, especially in this country? I mean, we are a wealthy country, not like we are a poor country. Yeah. We have money in this country. We have resources. Like, there's no reason why you should go and have to spend 3 and 4 and 5 hours, to get a simple...
Especially with all the technology we have today.
Absolutely.
Everything should actually be on computer systems.
Absolutely.
And this paperwork mentality should be out.
Blood work, you can get blood work results. There's some blood analyzers so they can give you results in 3 minutes. Now, when I did the prostate cancer clinic, in Canada, men would come in the morning, we'd take their blood in the morning. By the next day, the result would be ready. So what I would do is I would gather the results, put them online. So some people coming from out of town.
Yeah.
Some people traveling an hour, 2 hours, to get there, to get all this thing done. So, we use online banking. We're very particular about our money.
And everybody actually uses not even online banking alone, but a lot of people shop online all the time.
All the time. So why can't we make blood results available online so people can just use their smartphones or whatever and access them? Using the same security that we have for banking, we can do the same security for, medical
for online
records.
health.
Exactly. And also for sharing, records, because if things are set up electronically, sometimes it's easier to share with other specialists.
And it's really, really easy for a piece of paper to go missing, eh?
Oh, absolutely. And if there's only one piece of paper, there's no backup. Now, in this state of, this time of, electronic medical records, everything could basically put in electronic format, and you can have, you have these secure flash drives, so, there can be backups for systems, 2, 3, 4.
In more than one way.
In more than one way, right? But we're still on this paper route. Right, so we kind of killing a whole bunch of trees for no reason. We need the trees for oxygen, right? And when we have a system right now that we could put in place that can make, our healthcare system more efficient. And people's time needs to be respected. We all have families, we all have jobs to go to, right?
Agreed.
So let's make this thing more, effective. But someone has to be accountable. Like, these biopsy reports have to be found.
71.
And people need to be contacted. Do we have the addresses of these people? Like,
what information they really have?
What do we have? What do we have? Now, getting back to this report also, like I just mentioned, that not all elevated PSA means it's prostate cancer. This report actually says clearly there were 196 cases of prostatitis. Right? So prostatitis causing that PSA level to go up. Now, these 196 cases had biopsies.
Right.
Right. So these are cases where maybe a biopsy would not have been required, because a biopsy is not an innocuous procedure. There's pain associated with it if it's not done properly. There's a risk of infection. So if you don't really need to have a biopsy, you really don't want to have a biopsy.
Correct.
Right. If you're going to have the biopsy, at least you could expect a report.
But then if you do the biopsy and then there's no report.
That's a very frustrating thing. There must be some legal implication for that. People sign a consent saying they're going to go ahead and get this procedure done.
Yeah, and having done it once, you don't want to do it again.
Exactly. Especially if it's someone else's negligence. That thing's gone missing. So here we go again, right? So not all elevated PSAs mean prostate cancer. There's another thing that they find, something called high-grade PIN. And to make a long story short, it's just that they found abnormal cells in there. Now, these abnormal cells have a tendency to become prostate cancer, but it doesn't happen always. So again, this wasn't considered prostate cancer, just a precursor possibly for prostate cancer. So, there needs to be sort of protocols put in place as to how we follow, things like high-grade PIN to make sure that these abnormalities don't actually turn in, to cancer.
Folks, remember, you can call us on 628-4103. Any questions, any concerns, any information you got and you want to share with us inside the show, feel free to give us a call anytime during the show.
Yep. 628-4103. You can log on to online to 103fm.net, or you can send us a text to 4103. We're here to answer questions. Like I said, I know a lot of this information already. So we're here. We're doing this show to give you an opportunity to get some information about procedures in certain situations, a little bit of information about different disease types and what you should expect as far as healthcare when you go to see your healthcare provider.
Also, now they can send us WhatsApp messages to Dennis.
They can send us WhatsApp?
Yep, you can send us your WhatsApp messages with your questions. That's 299-4103. Right. I mean, it's easy, it's convenient, and it's free to message us on WhatsApp. So don't be shy, all the guys locking on, all the men locking on. You need to get some information. I'm sure you're sitting listening to the show every week.
Absolutely.
Just hoping for someone to call or message.
And it may not happen, so you may have to take that initiative, to make that call.
So if you don't want to call in, feel free to message us.
Send us a text, tell us what's up, let us know if there's a problem, you need to, have some, some sort of advice on. I don't make diagnosis, and the only medical advice I can actually give you is that you see a competent physician. But we could have general conversations about, prostate disorders. In the cancers that they found in our local population here, it's interesting that they found a significant number of cancers that were Gleason 7 and higher. So these are the sort of cancers that we want to pay attention to because they have the tendency to spread quickly. Now, the numbers, like I say, pretty staggering. 72% of all the cancers that they found were in the Afro-Trinidadian population. And what they found too is that a lot of the PSAs that were in the high ranges, so 100 and greater, were also in the Afro-Trinidadian population. So, things are serious. The Gleason 7s, I want you to keep in mind there are two types of Gleason 7. Now, Gleason 7 is considered an intermediate cancer. So it's not an early stage, which would be a Gleason 6, and it's not the really, really aggressive, which would be the 8, 9, and 10. So Gleason 7s are right in the middle. But there are two types of Gleason 7s. And I mentioned these in one of my articles. You can go to the blog. My blog is helpertrini.wordpress.com, and a lot of my articles are basically linked on the blog. And I think people, it helps have a little idea of what this Gleason grading system is. And basically, the pathologist looks under the microscope at slides that have prostate tissue on them, and he looks to see how far from normal the slides actually look. So he gives that. Usually, he looks for the most abundant type of cell, and he gives that a grade, which is a number from 1 to 5. So with 1 being closest to looking normal, and 5 being furthest from normal. So you can have a Gleason basically a 2 to a 10. He looks at the first most abundant, then he looks at the second most abundant, and he does the same grading system. So he gives the first abundant a number from 1 to 5, a second a number 1 to 5. You add the two numbers, so if the first one's a 3, the second one's a 3, your 3 and 3 gives you a Gleason 6. I think we have a call on the line. Hello, welcome to 103 FM's Men's Health Power. You have a question for us?
Hi, good night.
Good night.
Okay, so I'm listening to your program, and I am hearing you talking about the 71 reports gone missing. I had a similar experience where a private doctor recommended my husband to go to the Cancer Society. He went there and he visited a doctor there. And the circumstances came about where we had to go back to get a copy of the report of what was done there. Unfortunately, when we got there, they told us that my husband, get this, never visited their clinic. They had no record.
There's no record of his visit?
Nothing. Absolutely.
Did you go with him to that visit, ma'am?
I did.
So you were there with him at the visit? So,
I was.
And on your return visit, they said there was no record of the visit?
Absolutely nothing. It came like if something, it's like if it's a ghost that I was talking about.
So did he have any intervention when you went to that visit, ma'am?
Of course, the doctor there medically treated him, gave him an ultrasound, physically examined him, yes.
Mm-hmm. And there's no record of any of that happening?
No record.
Well,
so my thing about it is that accountability.
Mm-hmm.
Right?
Like, how can something like that happen? I mean, you showed up with him, so it's not like he went alone. Maybe he was having Alzheimer's, went to the wrong place. I mean, you went with him.
I did.
To the facility, and you went back, and there's no record that you were ever there.
Nothing.
Even though he had medical testing done on site.
Ultrasound, physical examination, and we sat and spoke with the doctor for about 20 minutes comfortably.
My goodness. It sounds like a trip down the Twilight Zone.
It did.
My goodness.
Another thing is I don't agree with the medical arena in Trinidad is that when you go to these doctors, they give you, like if, for instance, if they give you a prescription, right, even in pharmacies, and when they write things on a paper or on a label, sometimes you don't understand these people's handwriting.
Yeah, absolutely. I've noticed that myself. You're right.
And I have a serious problem with that because sometimes you go to the pharmacy and you don't know if these people guessing to try to understand what the doctors have written.
Well, you don't know if the medicine you're giving you, seeing that you can't see the name of the medicine,
my point.
You don't know if you're allergic to the medicine.
That's
how you going to tell?
Point.
Yeah, so it's, why are they doing this they're doing this handwritten thing. Why can't they have a printed document, right, outlining what the medicine is?
With a description.
You're right. What you're getting it for, what some of the side effects are that you should look for. Because, we're giving medications out. We're telling people what benefits we expect to see. But we're not telling people, when they could be experiencing something that they shouldn't be experiencing and need to stop the medicine.
And another thing I noticed that, well, first, let me say I commend you very much on what you're doing.
Thank you very much, ma'am.
We need to get the public. You're doing a medical men's issue topic, right, on a weekly basis. Men, stop being so coward.
Thank you. Thank you very much.
Come out and support and be brave about it. We can't sit back and be a 90s wonder. We have gone through that already.
No, but they will complain secretly, and they will complain in their little group of friends, this, that, but there's an opportunity now for them to voice,
their concerns.
and.
Well, they do voice, but when it's too late.
Well, it's unfortunate.
All right, so keep up the good work.
Thank you very much for your call, ma'am.
Okay.
Thank you
Bye-bye.
very much. Bye-bye. Yeah, so
the caller is right.
Absolutely.
When you look back, it's really too late.
Yeah, absolutely. Like, and look at these cases here. With a PSA of 100. Now, they said, they found Gleason 3 plus 4, like I was trying to explain that. There's 3 plus 4 and 4 plus 3. 4 plus 3 is a worse scenario than a 3 plus 4, right? The first number is an important number because it tells you the most abundant cell. So if the first number is a 3, it means that the most abundant cell they saw is a 3. If the first number is a 4, it's getting closer to 5. So the most abundant cell is a 4, which is a more abnormal looking cell than a 3. So that's how they look at it. And getting a proper diagnosis is very important. It's about time we take another break. You're listening to 103 FM's Men's Healthcare Power. I'm your host, Dennis Webster. Please don't touch that dial. We'll be right back.
And we welcome your calls at 628-4103. You can even send us your messages, your text messages to 4103, and you can send us your WhatsApp messages to 299-4103. We'll be right back.
Welcome back, ladies and gentlemen, to 103 FM's Men's Healthcare Power. I'm your host, Dennis Webster. I want to thank that caller, lady, for calling in and her support. We have real problems. We need to address them. They can be fixed, but we have to fix them in a constructive manner. Right now, there's actually no screening program in the Caribbean. There's no established screening program in the Caribbean. So one of the first things I think we need to do and to put into place is to have a proper screening program. Now, we don't want to find all prostate cancers because we know, and we've known for years, and researchers have known for years, that not all prostate cancers are going to cause a man a problem in his lifetime. We are more concerned about finding what we call the more aggressive cancers. So these are the Gleason 7, 8, 9, and 10. And according to this report that I'm reading right now, we found a significant number of Gleason 7s. Now, having said that, I myself have seen, wrong diagnosis, on the island. I have seen actually to date 2 Gleason 4s, and in my over 20 years of practice in Canada, I've never seen 1 Gleason 4. In general, prostate cancers start with a Gleason 6. So I don't know where those Gleason 4s came from, how they came about, coming to that conclusion. But I mean, to me, that's hugely suspicious. I've also seen Gleason 7s downgraded to Gleason 6. Now, one of what I regard as the gurus in prostate pathology is a doctor by the name of Jonathan Epstein. Dr. Epstein works out of the Johns Hopkins Institute. He's regarded by many as a guru in prostate pathology. He is a professor of pathology, and one of his first recommendations is that if you have a prostate diagnosis and it's not actually done by a pathologist who specializes in prostate cancer, your first step should be getting a second opinion. I mean, it's not an easy skill, to perfect. You have to be looking at, hundreds, probably thousands of prostate tissue. Even men who have prostate cancer and get treated with radiation, sometimes when they redo biopsies later on, radiation changes sometimes look like prostate cancer when it's not. So if you really don't have this skill of expertise to detect real prostate cancer, what's eventually going to happen? What can you expect? You're going to expect that you're probably not going to get the treatment that's appropriate for your condition. So, it's one of the things that we need to correct on the island. It's no secret. Some pathologists, absolutely don't have the expertise as others, and we need to find out, who needs help and who doesn't. The only way we can do that I can think of is by having basically all local diagnoses reviewed outside by a third party. I mean, this way we can give constructive feedback, to the pathologists on the island. If there's areas of problems, they can be, basically, addressed, by the, particular, maybe the medical board, someone, can take over, basically addressing issues like that. But, getting right pathology is a difficult thing, on the island. Not everyone's giving it. And as I said, these are real concerns now. Who's accountable? We need to know. Greg, any talk?
Someone has to answer the questions.
Someone has to answer these questions. As I said, first of all, the 71 reports. I personally want to know where they went.
Yeah.
1 or 2, okay. 1 or 2, maybe went missing, maybe in a wrong draw, or something. But 71?
71 missing 71. At once?
Yeah, so did they sign up was it a procession that was going out the door? How does 71 biopsy reports, how can 71 not be found? I mean, that's mind-boggling.
I think we could do better than that, though.
I'm sure. You listen to 103 FM's Men's Health Tip Hour. If you want to be part of the show, you have a question, you can give us a call at 628-4103. You can log on online at 103fm.net or simply send us a text message to 4103. I was saying actually to, I think Renuka was helping me one evening. I said, well, you know what? It looks like only women, calling into this show. Maybe we need to change it to Women's Health Tip Hour.
Yeah.
And start talking about,
because we have it for the men
and they're quiet in a corner. Nobody's calling in, right? One of the things, excuse me, for the women out there is they need to be aware of the new screening guidelines for cervical cancer. Cervical cancer is one of the cancers that where you can actually see changes in the cells before cancer develops. So it's one of those cancers that can be cut off at the path, so to say. Right? So it's important. And I think the new recommendation for women is ages 25 to 69. They believe they were doing it at a younger age before, but they believe that any abnormal changes that happen in women younger than that age usually clear up by the time they get to 25. So they're starting screening at 25. So all the women out there who've been so supportive and calling in to the station and expressing their opinions, we want to thank you, and that bit of information is for you. So please speak with your doctor. Make sure that if you're 25, that you start getting screening, and also that you get the what we call the HPV vaccination. Okay, so that's the herpes virus vaccination that actually there are over 100 types of the HPV virus, but only probably around 2 I think have been identified as causing cancer. I think there's type 16 and type 18. So it's important that you get that HPV vaccination to help protect yourself. In BC, actually, British Columbia, they came out with a report last year, 2015, showing that women who did that screening, they were able to cut down cervical cancer rates by 70%.
As you mentioned, vaccination, how often is it prescribed? You should take that vaccination.
I think they just I think it's just a one time you get the HPV vac. Yeah, I think it's just a one time. Cervical is not my area of specialty, but from what I have read, I think it's a one time thing. But you need to get screened
before.
Well, no, it's the recommendation now is every 3 years. That women get screened every 3 years, with Pap smear and the usual, because you need to take the samples of the tissue.
Well, I know most women, at least let's say 70% of the women. Mm-hmm. I think they always ensure that things are more in an order than men.
Well, we know that, yeah.
Well, probably even more than 70%.
The show confirms that, right? They're more proactive with taking care of themselves. And I think as men, we have to change that mentality. We got to become more proactive. If the idea of going for digital rectal examination is preventing you from getting tested for prostate cancer, you need to give me a call, because there are other ways that, there are doctors out here that I deal with. There are other ways of trying to basically keep you safe. Other ways that don't require you having a digital rectal examination. In some, what we do right now is something called prostate cancer risk assessment. So the focus that researchers and clinical scientists have right now is finding aggressive disease that requires treatment. Okay? Not all disease needs treatment. We want to find the aggressive disease that has a tendency to leave the prostate and go into your system quickly. And there are tools called nomograms, which are scientific formulas that have been developed to help doctors help you decide on, what to do next. Remember, medicine is an art. It's not a science. So we take all the scientific data, and we basically have discussions. Doctors have discussions with men, and based on that whole, the talk and the information, they come to a decision as to what's right for that particular man. Because once it's not like one size fits all.
Another bit of information to Dennis, mm-hmm. especially to those men who don't want to talk about their problems, their issues, maybe outside of the house or mm-hmm. outside of the family members, immediate family members. Right. I mean, a lot of information is actually available online.
Absolutely.
So, sometimes, as you said in a previous show, mm-hmm. you need to kind of verify and ensure that the source is one of those credible ones.
Exactly.
So, I mean, you can actually do some reading on your own as well. Mm-hmm. You can just probably let your children search it up.
Exactly.
And you can have a read for yourself.
And it could be a family sort of a thing. I mean, everybody gets to get information.
Before you go to check a doctor and that kind of thing.
Exactly. Now, a lot of doctors, even a lot of GPs right now, are doing medical intervention for men who have enlarged prostate. So you don't have to really send men directly to a urologist, to get, tablets like alpha blockers and the 5-alpha reductase inhibitors, which are tablets that they give to help men with, BPH and their symptoms. GPs are able to give that today. Yeah. So, I mean, GPs can't do the surgery, right? But they can give pills. So I think we have to, make sure that we're using our resources appropriately, right? We want our urologists, our surgeons to spend more time focusing on surgeries, not writing prescriptions for oral medications that, general practitioners can do. So these things, we need to, to take into consideration. We need, above all, to have policies and guidelines. Right?
And also, with things going missing and that kind of thing, there must be some sort of...
Somebody has to be accountable.
Yeah, somebody has to be able to answer as to why this is missing or why that's missing. Or, 71
reports they can find. 71, not 2 or 3, not, hey, maybe something went under the table, maybe the breeze blew something. There's none of that. 71 reports they couldn't find. Like,
I think it's just mere negligence.
And where, it could be there, but, if you don't have those reports, how do we know for sure that people actually, how do we know people actually got a report?
Yeah. Well, you heard the lady said earlier when she called in,
there was no record of their visit. So how does that happen? Like, these are things we need to be looking at. We can't take these things lightly. We're talking about people's lives here.
Yeah.
Right? Someone left their job, took a day off work to go and get the biopsy. Right? That was a salary that they weren't able to get to feed their families. So how do we make that worth their while? Like, now how do you go back and tell 71 people right now?
It's missing.
Yeah, we can't find your report.
Come back and do it again.
No, I had a fellow who waited 6 months to get his report, and he had to call for his. Right? Now, in a day, in a time where we have clinics called rapid biopsy results. So there are clinics actually in Canada that can give you biopsy reports within hours. They have men waiting 6 months to call in to get their reports, and now we're missing reports. And that's unacceptable.
Yeah. And
someone has to address that. So you're listening to 103 FM's Men's Healthcare Power. We're about to take a time out. Don't touch that dial. We're the first, the finest. We'll be right back. Good evening, ladies and gentlemen. Welcome back to 103 FM's Men's Healthcare Power. I'm your host, Dennis Webster. We're addressing some real issues here, this evening, and it basically speaks to things like accountability. It speaks to things like what sort of systems we have in place right now. How effective are those systems? Can we put more effective systems in place? How do we go about doing that? Every creed and race is supposed to find an equal place here in this country, yet we have everybody doing basically their own thing as far as screening goes. Some people are doing total PSAs. Some people are doing the total PSAs and digital rectal examination. Some healthcare providers are not even talking about, digital rectal examinations or PSAs. There are benefits to digital rectal examination. You're able to pick up not just issues with prostate, but also issues with anal and rectal cancer. So there are benefits, but as a screening tool, digital rectal examinations don't always find prostate cancer. And as we mentioned earlier, an elevated PSA level, which is a total PSA level, does not necessarily mean there's prostate cancer. There could be other things causing the elevation in the total PSA level, and men need to know that sooner rather than later. We need to reassure them sooner. We don't want to have people going home waiting 6 months for a biopsy report and things like that. That is absolutely unacceptable. So we need to fix that. Greg, you have any ideas?
There's so many things available, Dennis, to our leisure that we have with technology, and I think they need to focus a little bit more into the health sector and improving things.
Right.
Put priority where priority is needed, and better the life of all citizens.
Exactly. In Dr. Rowley's case, and I'm just going to bring this up one more time. He and probably, there are several other, Trinidadians in his position are able to leave the country, right? But that's not to get a second opinion. That's not the case for a lot of our local citizens.
Well, just to cut you across, most of our local citizens are not able to do that. So, they would have to more than likely get their both opinions right here in Trinidad.
Right here in Trinidad.
Because it's costly to go away. Not everybody can afford it.
Absolutely.
And these are things that we need to look into.
Absolutely.
As a nation,
Absolutely. So if people can't leave, I think we have an obligation
to give them good service.
To give them the best quality care they can get locally. And, from what we've seen so far, it obviously appears that they're not really getting that.
Yeah.
They're kind of being shortchanged right now. So, we need to get these things changed and put into place, and we can't wait another 10 years. Another thing I would like to see, I think would be the ideal is if you had a government that would make contracts with the people. Because, we always hear, this is going to be happening by there was one plan for the oncology thing that was supposed to be finished by 2013.
Yeah.
Right? So we're always getting, it's coming. And like, I want to know, well, when is it reaching?
Yeah.
Right? Because it don't seem to be reaching at all. And we're not getting any status reports. Like, and if it's not reaching, why is it not reaching? And who's accountable for not having it where it's supposed to be at this point in time? So we're going to be waiting 10-year increments to get updates and things like that. Like, it's ridiculous. It's like when you go to a doctor, right? A man who goes to a doctor having problems urinating, the doctor gives him a pill. Well, we know if he's going to get any benefit from the pill, we should see some sort of benefit in maybe a couple of weeks for some pills, right? So wouldn't it make sense to schedule an appointment to come back in 2 weeks and reassess to see if there was actually any benefit? None of that is happening. These are like simple, straightforward things. This is not rocket science.
Yeah.
Right? We can put these things in place easily, but we have to start. Right? Nothing is being done, and it looks like healthcare doesn't seem, I mean, they talk about it, but I'm not seeing the action that shows that healthcare is a real priority in this country. Right?
Absolutely.
Right? I know party is big on the agenda, but where's healthcare?
Yeah.
Like, we all like a good party, but we all want to be healthy too. So it's, I mean,
and
it's
you know,
time.
the funny thing is that you only know about this when you're actually in this situation.
Mm-hmm.
I mean, people listening to us now, right now as we speak,
Mm-hmm.
and some people might just be like, oh yeah, well, it's just a health show.
Mm-hmm. Mm-hmm.
But only when it actually gets into your home,
Right.
into your family, and then you go to the public health service and you get a lot of problems,
Mm-hmm.
you get a lot of run around,
Mm-hmm.
then you will know what we're talking about.
Right.
And then, you know, sometimes it tends to be a little too late.
Right.
As they say, prevention is better than cure.
Absolutely. Answer prevention is better than a pound of cure. Absolutely. Absolutely. So we need to start thinking like that. Like, when, like, I'd like to know definitive times. When is it starting? Okay.
Yeah.
When is the oncology center opening up? Right. And what programs are we going to be putting in there? And who are we putting in there, you know, to run the center? We already have a shortage of staff in the systems we have right now. Right. We already have people who are obviously need to upgrade their skills. So who are we putting in these beautiful centers? It's nice to build beautiful buildings, but what sort of programs are you putting in these buildings?
Is it going to benefit the citizens?
And, the citizens going absolutely. Good point. Are the citizens going to be benefit from what you're putting in? Because it doesn't look like they're benefiting a lot right now.
Yeah.
Now, this thing with chemotherapy, you know, there's a new article about we run out of chemotherapy. Like, how can we run out of chemotherapy? Chemotherapy is given on cycles, right? Because they know from large clinical trials that if you give the chemotherapy on this particular regime, meaning every 2 days, every 3 days, whatever the regime, that's how you fight this cancer.
Yeah.
Right? But if you're saying now, and we're hearing reports, well, it's going to be 4 or 5 weeks or so before the drug. Well, what is the cancer doing? Like, so you tell the cancer, hey, like hold some strain now. The drugs come in, right? Give us a fair chance to fight you. It doesn't work that way, right? And we talk about substitutes. Are these the right substitutes that we're putting in place?
Yeah.
So.
Absolutely.
Anyway, ladies and gentlemen, that basically brings him to the end this Men's Healthcare Hour. We've been listening to the finest, 103 FM. In closing, I would like to remind you that you should always take your health care. Don't be afraid to get a second opinion, especially in a case of serious illness. And don't be afraid to find a new doctor if you don't feel that you're receiving proper medical care. Your health is way too important to place in the hands of a provider who hasn't earned your confidence, isn't addressing your questions or concerns, and in your opinion is not giving you your condition adequate time and attention. And for those missing reports, please, somebody has to find them. We are accountable to our citizens. Good night, ladies and gentlemen. See you next week.